Failed back surgery syndrome is a problem that is bigger than a lot of people notice. It affects about 20 to 40% of patients who have had back surgery. So that's not a small amount. About 1 or 2 out of 5 patients who have back surgery will have failed back surgery syndrome. And what that means is that they'll have the same or more pain in the same area that was operated on. And some people say that pain occurs anywhere from a year or more later, and other people say that that's pain that occurs right after the procedure. And there are many reasons for this, and a lot of it has to do with the perioperative and preoperative workup of those patients. So for example, did they have the proper diagnosis? And studies show that 60% of the time they did not have the proper diagnosis. Was the behavioral qualities of the patient looked at? Psychological qualities, where they looked at? Socioeconomic qualities, whether they're work comp or whether they're personal injury or whether there's some other motives where they looked at? The medical condition of the patient, how deeply was that looked at? All of these things contribute to failed back surgery syndrome. And the one thing that I think is important to convey to not only the primary care physicians out there and the pain specialists out there, and the surgeons out there as well, but also the patients out there, is that surgery is not a panacea. In some situations, it's indicated, and unfortunately, their choices are very limited. But in many situations, there are other options, and we need to always look at options that have the greatest benefit with the lowest risk for all aspects of life, but definitely medicine as well. So if a patient comes back to a physician saying, doc, I had the surgery and my pain still persists and it's in the same area, the first thing that the physician should do is a proper history and physical examination, but also do a little bit of an investigation into what was done before the surgery took place. Was a proper diagnosis ever made? Were the proper steps ever taken? And those include diagnostic workup as well as minimally invasive options, injections, therapy, those kind of things. Finally, the physician should also never forget that even if the patient is coming back with the same complaints, something else may be going on. So always look at the fact that the original problem may still be persisting, and always look at the fact that there may be something else going on. Treatment options for failed back surgery syndrome completely revolve around the diagnosis for the patient. And some of those diagnostic tools include interventional options. For example, if we're worried about certain nerves that are still impinged or irritated or damaged, we should do certain interventional options, different nerve blocks, to diagnose whether or not those problems are in fact real. There are obviously conservative options as well that exist to look at non-organic issues. For example, during the workup before the patient has surgery, they should be monitored, they should be evaluated for behavioral issues, psychologic issues. Patients may have other medical issues, including things like central sensitization or central pain conditions. And I can tell you, I've seen that many of those patients are not worked up at all for those conditions, and they end up failing these surgeries. How much of this pain was an organic problem? How much of the pain was an inorganic problem? Those are important questions that should have been asked before surgery, and they're not asked before surgery. So definitely after someone fails, I think it's time to pause and say, we really need to look at how much organic problem or damage we have now, and how much inorganic problems or how much inorganic damage we have. They should look at things like anxiety, depression, socioeconomic factors. They should look at things like central pain and really take time to evaluate those things. With all pain patients, the primary focus is actually not pain management or pain reduction. The primary focus is on functional restoration. And to achieve functional restoration, we need to reduce pain. Right? So if someone has 10 out of 10 pain and they're saying, I can't get out of bed, how are you going to restore their function when they can't get out of bed? You need to get their pain lower so they can engage in activities to become more functional. So that's always the primary directive, is to become more functional. Now, that becomes especially important in failed back surgery syndrome. When those patients come back and they have the same or more pain, it's not all about saying, well, gee, how can we get your pain lower? Just to say, hey, we got their pain lower, therefore they're no longer a failed back surgery syndrome patient. That's not the key. The goal is to reduce their pain so they can become more functional, so they can engage in more activities, build more strength, and break out of that failed back surgery syndrome naturally, not artificially. To get them to have lower pain, that's where various other options may be included. Conservative options like physical therapy, acupuncture, massage, meditation, cognitive behavioral therapy, medications, those kind of things, as well as interventional options to diagnose and to treat, to reduce inflammation so they can become more engaged in those activities.